Hey folks, we're back here at Circuit World in Blue Ridge, Georgia. A little froggy out there this morning. Okay, do the weather report like a chopper 5, you know, chopper 5 over Blue. Yeah, you make the chop. Hi, how are you? I love the tie. Veterans Day yesterday. Thank you for your service.
Thank you.
I know this jacket all too well. I know that tie. But
it's lots of use, doesn't it?
Dr. William Whaley and Dr. Raymond Tidman here with us. Ask the Doc. Dr. Whaley, thank you for your service. Veterans Day. And I know you said you had a couple opening comments.
I was thinking about small town America. You know, we talk about we're here at small town America. So we were on last Friday. Last Saturday they had the Veterans Day parade on Saturday, which, you know, wasn't on Veterans Day. And I drove the old red pickup truck, which I always do. But I was disappointed in the number of people that were on the street. Now, it may have had something to do with advertising. The weather was good. Good. 4th of July parade is huge because there's so many tourists up here. That put me to thinking about the election. We had 440 people that voted in the city council mayor's election, and I thought about how much money was spent on ads and stuff. I think we were about like the federal government. I'll bet you that in that election, there was probably $30 to $50 spent for each person that voted, and this is small town America. This isn't that's not a terribly big thing. And then the other thing I was thinking about was the separation of church and state, because we're continually here. The church is such a big part of life. Football and playoff games a big part of life. We're working tonight in the visitors' snack bar at the Fannin County playoff game. You know, small town America, playoff football tonight, sponsored by the church. We're going to be in there. Now, is that against somebody's rule that the Baptist church has got the people working in at the school selling hot dogs and stuff? We can get away with stuff up here you can't get away with somewhere else.
I will tell you this. And what you just said, I just want to change something.
Yeah.
We should not be to where we even say get away with. That's not where we should be in this country.
You're right.
You know what I'm saying? But I understand what you said.
Exactly, yeah.
You know? I understand what you said.
I'm just so happy to be up here. And to see that, we have a 4th of July, we have a Veterans Day parade, went all the way through the city. Could have been a few more people there. We could have had more voters for the city. It's 1,000 registered voters. That means less than 50% voted. That's not, presidential elections, if it's not got Trump in it, or got 50% of people voting. So those are all the same. But the thing about the football and the church sponsoring or I guess you donate the time or whatever. I just love it. It's wonderful.
Absolutely. And you wait till tonight's atmosphere, because there's nothing better than small town America, high school playoff atmosphere at night.
Are you going to be putting it on television?
Well, we won't be televising, because when you get to the playoffs, the state takes over all the rights on that.
NHH.
But right. But we'll have somebody on the sideline up there. As far as
that's on that NHBH, something or other. I got that on my thing because I watched my grandson play in Atlanta sometimes.
Exactly.
Well, we're supposed to ask the doctor questions here.
I'm not the one talking.
We need to talk one other thing.
Yeah.
Oh, what else?
100th anniversary of the Tomb of the Unknown Soldier.
Yes.
Yes.
If you are not into history, that's a piece of history you need to learn about.
And what was the name of the ship that brought the unknown from France to the Potomac River, called the Olympia, and that ship is now being pulled up at the 100th anniversary into the Potomac River somewhere, or some Maryland or somewhere. It's going to be a museum.
Nice.
And then for the first 4 months it was open, it was just flat, and people used to go out there and have picnics on it. And the the American Legion didn't want them having picnics on it, so they built it up about that high in the next 20 or 30 years, and then at the end of World War II they put that big thing on top of it. So it's evolved since it was put in 1921, 100th anniversary.
Anything else on
100 years ago? 100 years ago was 1921, right, Ray?
My math
would have seemed so. All right. Well, that's your math lesson from the doctors. All right. This is a really good question here. This is really a PCP question. And it's what we call in oncology, I've told you before, survivorship, long-term things that happen after treatment. My wife is 75 years old and in excellent health. She had breast cancer with chemotherapy at age 37. So she had young chemotherapy, and it stopped her periods, which was very common with the treatment that was given in those days. It was pretty powerful chemotherapy. She recently crushed a vertebrae in her back with a minor slip and twist in our kitchen, so she didn't fall out or have a car wreck. And her PCP diagnosed osteoporosis with compression fracture that he thought was caused by her early menopause. She had never had a bone density before, so he ended up doing a bone density on her, and he must have measured her, because she was 3 inches shorter than when we married. Well, I played football in college at 5'11 and a quarter, and I'm 5'9 now, so that's 2.5 inches. I've shrunk, and I'm not a woman that's postmenopausal. How much have you shrunk, Ray?
I haven't yet, but have you had your bone density?
Yeah, I have.
A lot of people don't
If
do
you
that.
go get yourself measured, you've shrunk an inch or two. I know Brian is. Anyway, go ahead.
I'm looking forward to shrinking. I need to shrink.
The other way, yeah, all right. She went to see a new oncologist, and he diagnosed her. I guess this PCP sent her back to the oncologist to see if something's going wrong. And he diagnosed her with the mugus that you discussed a few weeks ago. Now, remember, that mugus occurs in a lot of healthy people. But anyway, he found that. He said it was minor and was not the cause of her severe osteoporosis. Well, I think the reason this guy's asking the question, several reasons, I guess. But if it was myeloma, that's one of the things that causes people to break their back, right? Well, this woman clearly doesn't have myeloma, or that x-ray probably would have shown a bunch of holes and not just this one compression fracture. Anyway.
Repeat her age again.
75. But she's in good health. All right, he sent her for a vertebroplasty and recommended Prolia, calcium, vitamin D, and exercise, and follow up the mugus routinely. What do you think? Well, I'll tell you what I think. Sounds like she's gotten really good care. But we're going to go through this a little bit together here, because this is a primary care diagnosis in a patient who has this disease, accelerated because of her cancer therapy. It took her ovaries away at age 37. The average age of first menstrual cycle in the United States is 12, and the average age of spontaneous menopause is 52. So she had 15 years of advanced loss of ovaries. That makes her worse. All right.
She's had good care post finding a pathological fracture.
Yeah, excellent
She's not
care.
had good primary care
In that
before
period.
that.
That's correct. And we're going to come to that in a minute. So pop up that first one there. This is just a big old slide here to show you that osteoporosis has got a lot of different signs. It's got a lot of different causations. Pull that down, because the way you think of osteoporosis and this woman, I want you to look at this. When you see this woman, this little bent over back, and up here in the country, you see a ton of women at the Ingalls with that bent over back, and you'll notice across this, there's a loss in vertical height. This woman is 75. Well, she got to this point way back here because her ovaries were gone. And this is just sort of a cross-section of the fact that the bone is losing its calcium. So pull that one down. This is the crucial issue here. We're going to show something in just a minute. This woman cracked her vertebral body. When people have a spontaneous fracture in their spine, it causes pain, and it's a big deal. But you'll notice the other bone they got here is the femur. So pull that one down. I've always told BKP to watch the don't put the next one up yet. Watch the obituary column. Remember how many obituaries say died as the complications of a fall or died following a fall. Put up the next one. here is the deal that we see so frequently and so tragically. Here's an old guy who has busted his hip in his house. You got that up there so people can see it? Now pull it down. Now that guy is the poster child for the I've fallen and I can't get up button, right? Because if he lives alone, he could lie there with that fractured hip for hours or days. He goes in the hospital, he gets that hip nailed, he gets a pulmonary embolism or he gets pneumonia and he dies. So you will just go for the next week, read all the obituaries, the Atlanta newspaper, and you are going to discover a huge number of them that say died as the complications of or after a fall. That's the issue. Okay, so pull that next one up. The risk factors here are not just being postmenopausal. A lot of this, like the hematologic things on the right-hand side of this big graph, that's the MUGUS. There's kidney disease, there's Cushing's disease. You can pull that down. Most of this is old age, menopause, and we just caused an early menopause in this particular woman. So there's the picture. Put that next one up. That's what Ray found in the radiology department. See, that's an MRI, and those vertebral bodies. You need your glasses. You see how big that vertebral body is? That looks like that little thing in your old can of salmon. Remember those little vertebral bodies in your can of salmon? You see that one's totally 100% gone, right?
Pancake.
Smashed down. That woman's back hurts. Okay, pull that one down. When this first came out, this was a big deal. We call this a cartoon in medicine. And this shows that this you see this needle out here?
Yes.
This can be done right up here at Riverstone by a doctor right there, Dr. Tidman. And they walk in there, they do it, and they turn around and go home. So this used to be you had to go in the hospital, they gave you anesthesia, they put the needle in there like that, and then they blew up a balloon to kind of jack it up like you'd be jacking up a car and open that thing up. And then I would say they'd put plaster Paris or silly putty in there. But what they do here is they put that needle in there, and then you'll notice this is pushed back up again. I don't know whether they did not use a balloon, but anyhow, you can pull that down now. So they've put the equivalent of plaster of Paris or silly putty in there, and they have reestablished that bone. And that patient will go home, a couple hours after this whole thing starts, the back will feel just fine. Smiling. All right. So that was the treatment of the broken back. All right. Now Ray said she didn't get real good primary care. So throw this next one up, and then we're going to pull it back down, and Ray's going to take over. But when they're talking about treatments of osteoporosis here, their drugs, Prolia is a shot, and that's what she really needs because she's got really bad osteoporosis with a fracture. And then it talks about exercise, and it talks about vitamin D, it talks about calcium. Pull that one down now. But they're all talking about treatment of osteoporosis. He said back when she was 37, she should have had some primary care doctor that was talking to her about the prevention of osteoporosis. Your turn, Ray.
So let me mentally jump back to that one sheet that said risk factors. Basically, after you get to over age 50, you should be thinking DEXA scans. You need to know how healthy your bones are. You have some illness before then, prolonged, laid up in bed.
Now, this men and women?
Men and women, okay? You're laid up in bed for weeks. Any long illness, your bones start deteriorating, okay? You're on medicines that take your ovaries out, that reduce your calcium.
Well, you're taking steroids for asthma or something.
For asthma, chronic asthma. So one of the things that I ask my primary care students to learn is that you want to identify for that patient early on what are the problems that are likely to take them out. You look at their family, you look at their occupation, you look at their previous histories. You look at all those things, you say, okay, well listen, for the rest of your life, I know normally you wouldn't get a bone density until 50, but we're going to start them now at 35 because you were in bed for 2 months with pneumonia, and it took you forever to get up, so your bones are forever weaker, right? The second big point why this is such an issue is if you're an individual and you break a hip, and end up in recovery in a nursing home, the chances of you living through the next few years is a lot less than most cancers. Okay, so you don't want to.
What I just told you.
Yeah.
long-term complications of a fall?
Yeah, fall. I mean, you end up in a nursing home. You're counting your last months. So I'm talking about even if you survive. And I just this week I have a lady who's in her 60s, skied, husband retired motorcycle cop. His mental process is such that she has to take care of him all the time, 24/7. She's got to be watching after him. She fell, it's low, we call it low energy impact, broke her hip. Would not have expected that. Okay. Well, now her husband's having to have neighbors come look after him because he can't take care of himself. She's desperately trying to get over this hip and get back home, and her whole life's upside down. Another patient of an 80-year-old fellow slipped getting out of a car. This is a little more farther back. Help, I can't get up. They didn't have the button, and he was laying beside his car for 2 days. By the time he was found, his kidneys were shutting down, and everything was going south.
Right.
So this is a serious problem, and your bone health is something you need to pay attention to because you don't see it.
That's right.
You'll pay attention to it when you break something.
Well, anyway, let's go back. So just for common things, I'm not going to try and be a PCP, but when you get to maturity, you really need to be taking vitamin D or know your vitamin D is normal, because the vitamin D level is made good when people used to work out in the fields, we're in the sun all the time, and now we're wearing sunscreen and we're not getting much sun, and vitamin D is fortified put in milk, but we don't drink milk because we're worried about our cholesterol. So you got to worry about your calcium, worry about your vitamin D.
Can you say that one more time? That is so important. We are different creatures now. We're not in the sun, and we only make vitamin D through
Well,
our
I don't
drink fortified milk when I do.
No, I would do it. I would do it today if my doctor would be okay with it, but my doctor's not. So I don't drink full strength milk anymore.
Doesn't have to be.
I'd be over there. It'd be vitamin D. It'd be in my grocery cart.
Well, no. Skim milk with no fat has vitamin D in it.
Yeah.
It ain't got nothing to do with the fat.
So I buy 1%.
Don't get the 0%.
Hell no. Excuse me. No. Don't get in the middle of me and my milk. You know, my milk, leave it. But I get the 1%. But my mom used to say jokingly, when we were kids, she'd have to buy a gallon for me and a gallon for the rest of the kids, because I believe you're supposed to drink milk. And I also take my vitamin D every morning.
I know what your mother said.
Oh, no.
She said, my son, he's on a life support machine, my refrigerator.
Yeah. Well, anyway, I was trying.
Sorry, I didn't mean to. No, but he started vitamin D. I like milk.
Well, good, but you're not the average guy. The average guy.
You got that right, baby. Truer words never been spoken.
Well, you're certainly not the.
All right. Oh, you're gonna get.
All right. So we got a long way to go here.
All right.
We talked about just about every couple of times. We talk about the difference between biological age and chronological age, and the fact that. And I guess maybe I'm a little more sensitive to it because I'm getting older, and I'm sure Bruce is a little more sensitive to it because he's getting older. But when people want to talk to us like we're, some sort of ancient dinosaur and that we ought to just be put out to pasture, but frequently we mention that somebody suggests hospice, and I guarantee it's always a young doctor that's suggesting hospice to somebody in their 70s or 80s who's in basically good health except for the acute problem. And that's what immediately got me about this question. My mother is 85 years old. Now that's older than me. That's really older than dirt. And up until 8 weeks ago was living alone, driving everywhere, and going to the gym for silver sneakers 3 days a week. She has had a sudden loss of 40 pounds that the doctor said was 15% of her body weight. I have no idea, which means he probably didn't know what she weighed, but she looks thin. Her PCP did a CAT scan because her belly was pooched out even though she was thin, and he found masses in the abdomen. The oncologist says not to go for hospice until he knows if she has a lymphoma that could be easily treated. So that means that somebody between the time the primary care doc found this thing and the time she ended up in the oncologist's office, it was probably some guy in an ER, said go to hospice.
That's
Yeah, no, well, but you know, she's 85 and she's lost 40% of her, 40 pounds. It looks bad. I'm just telling you, that's
discrimination.
That's age discrimination. Praise the Lord. Her sister says maybe it's her sister. Her sister says she's going down so fast that she should go to hospice. So it was the sister that said go to hospice. Mother is very private. Well, I can tell you that. But I went to the oncologist with her, and he said a needle biopsy would be easy and encouraged her to do it. Well, I just showed you about sticking a needle in a vertebral body and blowing it up as an outpatient at the top of the hill and going home in a couple of hours. So, I mean, that's around your spine, your great nerve, we call that in medicine. I mean, that would be scary to somebody if they didn't know it was an easy procedure, wouldn't they? All right. So, the oncologist said a needle biopsy would be easy and encouraged her to do it. She asked me what I think, and I ask you what do you think, and I need an answer by Tuesday when we will see him again. All right. So basically, she's going to see the doctor. She's going to see the oncologist on Tuesday, and the poor son's trying to negotiate between the sister. Maybe the sister's in the will and wants the will, to go early. I don't know. What do you think, Ray? You think that
I think there's some
in the will?
conflict. There's some conflict there, and she needs to be
There's a
removed from
family conflict. Okay, put that first one up. This is not going to take very long because I'm just trying to explain that doing the.
Yeah, well, let me say this,
Yeah,
because
go
I
ahead.
know you got the answer, but I want to go back to the beginning. She's 85, and up to 8 weeks ago was living alone.
Just blowing and going.
Driving, silver sneakers, going to the gym just 8 weeks ago.
And in 8 weeks, she's lost 40 pounds.
But
That's good quality of life at 85.
exactly. So go ahead. I mean,
She's sick as a barking dog now. I mean, no doubt.
yeah,
about
I
that.
understand that.
Okay,
I
now-
get it.
All right, put that next one up. So we're going to talk about basically the technique of doing a liver biopsy. Not about the outcome, but I think the oncologist is probably right. She's got probably a greater than 50% chance that this is going to be a lymphoma and not pancreatic cancer or something, because she didn't have any antecedent symptoms of abdominal pain or anything we know about, because she was blinking going to the gym until 8 weeks ago, and suddenly come on, take your weight away, blow your tummy up. I mean, lymphoma's high on the list. Okay, we can pull that little thing down here. Now, just so you know, we're paying attention. The different causes of swollen lymph nodes in the abdomen can be tuberculosis, it can be brucellosis, it can be sarcoidosis, it can be colon cancer, ovary cancer, any kind of cancer in the stomach. It can be lymphoma. Pull it down. So this is pretty common for women. I like to think that not most women, but I'd say a third or more women at some point in their mammography history has had to have an ultrasound done to look for why there's a little something funny in the mammogram. But I believe almost all women who have had a child in the last 20 years have had an ultrasound to show the baby, right? So when we're talking about right to life, when is there a heartbeat? When is it a real human being? That's an ultrasound. Now, everybody's familiar with that, right? Bruce, you're familiar with ultrasound over there, right? All right. Okay. Now, so this is an ultrasound machine.
Right.
That's getting ready to be put on this woman's tummy, just exactly like it'd be put on his daughter's tummy if she was pregnant. Pull that thing down now. And so I just want you to imagine that this is when you see these pictures of a female, that right here, that uterus has a little baby in there. Well, now you see this big old thing, that's not supposed to be there. That is the abdominal mass, or an abdominal mass like this lady's got. You can pull that down. That's making her belly protrude. Frequently in these kids, when their parents are 35, 40, or a little bit older, they'll actually put a needle in there and take out some fluid and do genetic tests on it and stuff. So this is a common procedure done for lots of other things. It's not going to be any more trouble on your mother than it would be on a healthy young woman. She's going to go in there. It's going to take 10 minutes. Once they get her in the room, you're going to have a diagnosis, and you may find out it's something that can be treated. So I would say you're getting good advice, and don't let the sister run her out to hospice.
So I'm reminded of 40 years ago when you're an impressionable young medical student and you have a very senior superior oncologist, and he says something to you never forget. There's no body cavity that you cannot reach there's no body cavity that you cannot reach without a strong arm and a 4-inch needle.
Yeah, that's right. That means invasive radiology.
You can get to it.
You can get to it. Now, if you got to be pretty sharp to stick that thing around over this.
All right, so
we
can
say
I-
things with Latin nerves. You got aorta and vena cava and all that stuff in there. I don't want to do it, but there's guys down at Northside Cherokee that can do it.
We're not cowboys anymore.
Yeah, we're not.
Well, let me say this, and I'll put it this way, because I don't know that I heard you answer the question. And my what I'm saying is, are you comfortable with advising them on Tuesday
to get the biopsy.
Get the biopsy, because
I'm very comfortable with it.
Get the biopsy.
Get the biopsy.
Okay, because mom could.
Look at your mother. She might have a lymphoma.
Listen. I'm gonna tell you something. Mom could go back to being 85 just 8 weeks ago. That they could get that back.
Right.
That's
exactly.
possible.
Yeah, not impossible. It's
Right.
likely if that's lymphoma.
It's likely, right?
Yeah, it's a likely outcome if she has lymphoma.
And if
It's
she
pancreatic cancer or something else.
she lives to be 100 years old and she gets down to only going to Silver Sneakers once a week, that would be fine.
But there's also some predictive value. If this is pancreatic or ovarian or some other cancer,
Right.
then the treatment hazard benefit ratio she may elect not to take, and then she could go to hospice. But I think you need more information before you take the clinical picture of weight loss and weakness to say go to hospice, because there may be something that you can fix.
Well, I mean, it's the very reason why people like Bill exist and our well-trained physicians exist. He's looking at this lady and says, you know, the likelihood of this being a treatable cancer is high. Let's figure out what it is. Now, there may be some other presentations of other kind of cancer. Say, well, no, that's very damn sure it's 99% is pancreatic cancer. So,
Particularly if she'd had belly
So-
aches for months, and our blood test CA19 was high, we wouldn't even have to biopsy her. But anyway, so I think they're
Treatable. It's very treatable.
All right.
Thank you, Georgia cancer specialist affiliated with Northside Cancer Center. We appreciate this. So you have a tab. Okay, as always. Where do you keep finding these? I mean, you got a stash
If
somewhere?
I tell you, I'd have to kill you.
I don't want to know.
He's got agents out looking.
Yeah, you got. I mean, okay.
The truth really is there are people who are bringing them in now.
He knows a guy.
I'm not
Contraband.
He knows a guy.
I got a guy in Chicago that'll break your legs. Anyway, so that's where these are coming. You notice I'm against the Coca-Cola company for reasons that I said, but if they bring them to me, I will drink them. Okay.
All right, moving right along.
well-
I'm looking down at his question. Dr. Whaley always does the news of the week, and he pulls some things off there, and he's holding the paper down with the paperweight
tab. All right.
with the
so
tab.
I began in the green room. Ray and I were talking about the approach people take to the news, and well, first of all, let's just quickly say, you see that number right there?
3.8.
Okay, that's the positivity rate in Georgia yesterday. Last week it was 2.
Right.
July it was 1, and the peak in the upswing was 20.8.
Right.
So we're down to the point now. Masks should be off, opened up. Go do what you want to do. Fine China should be shot. Should get their shot. Secondly, it came out this week.
Don't shoot them.
Don't shoot them with their shots. Okay. They came out this week that after 6 months, all of the vaccines, regardless of which ones you give, have markedly diminished effects, a markedly diminished effectiveness that gets to below 50%. Now, if you look, it still is protective. I mean, it's a variant. You know, the regular COVID's gone. We don't have regular COVID anymore, and we don't have an immunization against the variant. But the immunization against the regular virus still diminishes the intensity and the death rate from the variants.
And the risk benefit for the high risk patient
It's still there.
is still
Take
worth
it. Still take it. But I'm still telling my childbearing age women don't fool
No,
with it. The
yeah.
kids don't fool with it. I mean, but anyhow, so we're not. So we are pro-vaccine for you because you're the biggest risk factor there is. Weight's the biggest risk factor. Age is the second. And then all this stuff about chemotherapy and MUGUS and CLL is even below that. So we're still for that group of people. But anyway, here's what I want to get to. People talk about the alternative treatments for the COVID in the hospital, and if you read the protocol they use at the local hospitals, it's got zinc in it, it's got ivermectin in it, in the local hospitals. Now, that's not at Emory, but in our local hospitals up here, they got the antibody, they got steroids, they got the anticoagulants, they got everything in the recipe that they use at Emory or the NIH, but they got ivermectin in it and they got zinc in it. So years ago, I remember when the first thing started coming out about zinc helping the common cold. Remember that? Now that was everybody's, man, you need a zinc, that'll get rid of your common cold. There have been hundreds of articles published, and right this minute, you don't hear anybody touting zinc as a treatment for the common cold, all right? Now, yesterday, there was a huge study from out of Australia where a researcher did a meta-analysis. So when you do an experiment and you got 300 people in it, you get some data. But if you take all the experiments together that have been published, you get 30 of them and you end up with 10,000 people, you've got more numbers. So anyway, it came out yesterday. There are different ways to take zinc. You can take zinc as a nasal spray once you start getting congested. If everybody in your house is sick, then you can take zinc as a pill or zinc as a lozenge to sort of help you maybe not get it. So there's different ways zinc has been used. When symptoms start and you put it in your nose, you don't put it in your nose till you get symptoms. So, but anyway, taking all of these studies together and looking at them, there was a benefit. It ain't a huge benefit, but like 18% fewer people that ended up getting having to stay out of work, and 38% of people got well quicker, and so forth. And so the data was indicative, not overwhelming. But the point I wanted to make was that when the article was quoted in the news chose to say that the author of the article that put together the group to do the meta-analysis was a paid consultant to governments, I guess to Australia and others, and to pharmaceutical companies on alternative medicine treatments. Like that was bad. So I said to Ray, who's going to have the interest in doing a study of this type except somebody who's interested in zinc? I mean, so they made like that was a bad thing. And then they got a comment from a Harvard, somebody in the United States, pediatric infectious disease person, who said, this is indicative information that should be further looked at. Well, there's no harm in that. But it's not a game changer, I think he said, was the next thing. But then it said, this guy doesn't have any conflicts. Well, see, they make it sound like it's an argument. The second guy said that it's good information. But by putting it in saying he doesn't have any conflicts and the other guy's a paid consultant, they make like that these two guys are at war with one another, and they're not. And both of them look at the same data. Both of them say it has indications that it's helpful. It doesn't have any information that it's harmful. But they make these two doctors making collegial discussion. Excuse me, they weren't making collegial discussion. They were just asked. But neither one of them criticized the other one. But the way they put the words together make it look like the doctors are in conflict. Do you agree?
Totally. It's just. Are we ready to wrap?
Well, no, years ago when they took Zyacam off the market.
Did they?
No, but when the old formula, they came out and said that the nasal swab was causing people to lose their sense of smell. Remember that?
And this study said that did not happen very much, and the copper didn't go down.
And they took the old school Zyacam. You can still get Zycam, but
He pulled it up
they
right there.
yeah, but that's not the old school.
No, I understand.
That's a,
It's
so
a
I
new
went
formulation.
out. New formulation. So I went out and bought the drugstore out of the old school stuff. And I stocked up my medicine cabinet of old school Zycam.
Well, then it's got a thing on the bottom that says, best if used before. Don't worry about it. It's not going to expire.
I
So-
thought you were going to tell me you're using Celsius Blue now.
No. But I went out and bought the old school Zycam, packed the medicine cabinet. I probably still have several swabs. But I take zinc every day. I take a zinc tablet every morning.
Well, you didn't know I was going to
Bill,
talk about
I
this.
think
did
that
you?
explains it.
What? Explains what? They want to know. They want to know what that means, and so do I. No, I take a zinc tablet
Well, his
every
sense
day.
of smell's no good, so he has to eat more to make up for it.
Do you feel picked on this morning?
No,
Yeah,
I'm okay
all
with
right.
it. I'm totally. But no, when you talk about that, zinc, I take my zinc, I take my magnesium, and I take my vitamin D every morning.
Well, and then, well, if
Is
you're
that
gonna-
okay?
It is now, but you gotta take care of this big piece of news.
You want to talk about Sesame Street? How to get to Sesame
No,
Street?
no. I want you to talk about.
After Sesame Street's Big
Big
Bird tweeted that he received the COVID-19 vaccine, Senator Ted Cruz, Big Bird over. What about it? What about it?
What?
Criminal advertising.
What?
It's total.
If that's not a stretch,
Well, we talk about children having games and toys and stuff, advertising them all the time, and
That
now you're
offended me.
manipulating those little things.
I told you last week.
That
I'm going to
offended
say
me.
exactly how I feel. Is I do not know why we're experimenting on children, and that's just my opinion. I'll leave it at that. And it's not the opinion of the medical facility or you two. It's my opinion. I don't know why we're experimenting on
to
children.
use Big Bird,
And you're right, using Big Bird to experiment on our kids is just, it's.
So one of the things that I want to end with is, and Bill and I hit on this, I think almost a year ago, about all the knock-on secondary effects of trying to shut down the economy,
Right.
stop cancer screening, stop doing all the routine health care. Multiple news articles about ERs packed with people, not with COVID, with, having chest pain, heart attacks, newly diagnosed cancer, all kinds of stuff that have been put off, and now they're flooding into the ERs. So this whole business of shutting down things and stopping all the well-sewn and worked out algorithms that we had in order to protect the bulk of humans is now coming to roost. So people need to get out there and get their screening done and get caught up and live their lives, okay? They need to live their lives. This is a treatable disease. You find and know of a doctor who treats it, and you identify them, and you go on with your lives. And one of the hardest things I see happening to people nowadays is the aloneness, the separation, the anxiety of disrupted lives.
let me
Get
give
back
you.
to living.
Let me go to another place with this because this is interesting. I had to mail something from my Atlanta office to a colleague whose office is across the parking lot. It was an EKG because the Xerox EKG, when you transmit it electronically, isn't of a good enough quality. He needed the real one. So I mailed it, and 2 weeks later he calls me on the phone. I never got that EKG. It's across the parking lot. So I had my nurse walk over a copy of the EKG, and a week after he needed it, it was a preoperative thing, that letter arrived in his office 21 days after I mailed it across the parking lot. Now, this morning it says that if Joe Biden's mandate is enforced, the Postal Service will lose so many people delivering mail that you'll have delays in delivery. Now, if 21 days delivering a letter across the parking lot isn't pretty much a delay, I don't know what'll happen to the postal system if this mandate goes through and a bunch of folks don't come to work and change their job. It'll cripple the Postal Service, which is already pretty crippled. But you see what I'm trying to say about that? It makes no
I
sense.
got you loud and clear. Final thought
Final
of the
statement, being American, say no to tyrants.
day. Say no to tyrants. And you?
I've already said it.
You already said it. Thank you, Georgia Cancer Specialist affiliated with Northside Cancer Center. We appreciate you for this segment. You got the day off?
Yeah, it's going to be rough. I got a week. I got to go down there and take care of things.
Take care of things. And you got to get.
Are you going to?
You got to go to
When you
work.
coming back?
Hey,
I'll be back Saturday week.
Oh, would be by myself next
you're
week.
solo next week. Yes, sir.
okay. You got to go to work.
I got to do a bone marrow in 1 minute.
Strong
All right,
arm,
let's get him out of
4-inch
here.
needle.
Let's get him out of here. We'll be back right after these messages with the All-Star Political Panel. Take a break.